Hello everyone, this is Dr. Alex Vasquez with Part 5 in my clinical review of vitamin D deficiency in adults, this time focusing on nutritional neglect versus antimicrobial defense. Today's topics include the following: what we need to know and what we need to know right now. So I am going to focus on vitamin D in immune defenses. Again, this is Part 5 of a series, so hopefully all of you have seen the previous 4 versions, which kind of segue and build into this one, although of course this one is independent. So again, I'm going to focus on nutritional neglect and nutritional immunology. I think that hopefully most of you know I've been working on this topic for many years. I published in 2014 a small book called Antiviral Nutrition, and that was folded into the 2016 edition of Inflammation Mastery. So just like I've done with the previous 4 videos, today I'll introduce some biological plausibility, and then we will dive into the clinical evidence. One of the essential realizations for today is that vitamin D is active in essentially every aspect of nonspecific defenses, which I reviewed in video number 3 on barrier defense, innate immunity, and acquired defenses. So I'll read that one more time. One of the essential realizations for today is that vitamin D is active in essentially every aspect of nonspecific defenses, innate immunity, and acquired defenses. The activity of vitamin D within the immune system and various nonspecific defenses is direct, indirect, and redundant because many systems within the immune system itself are direct, indirect, and redundant. You can choose any aspect of general or specific immune defenses and then state that vitamin D plays a supporting role, and you'll be correct. I just summarized 60 minutes of detailing immunology into one sentence, and I'll read that to you one more time. Choose any aspect of general or immune defenses and then state that vitamin D plays a supporting role, and you will be correct. The concept of innate versus acquired immunity is clinically outdated and should be replaced by the realization that the entire body functions in unison in defense against invading microbes. So the entire body is the immune system. The immune system is not specialized and localized to certain glands or certain organs or certain cells within the bone marrow that then move to the thymus and then the gastrointestinal tract, etc. The entire body functions as the immune and defense system. Furthermore, and you'll see mention of this in some of the research that we look at today, too many people and too many researchers and clinicians remain focused on 1,25-dihydroxyvitamin D as the active form of the nutrient, and I'll show you why that's not the case today as I introduce and review a little bit of vitamin D pharmacology from one of my earlier video presentations this year. I think some of you will be happy to know, point number 9 here, that I'm not going to look at any animal studies today or any in vitro studies. I'm going to focus exclusively on clinical research, and that's because the in vitro research and the animal studies are simply mechanistic, but that really doesn't explain to us how the nutrient works in clinical practice. And for those of us who are clinicians, that is, of course, what we are mostly interested in. So as I state here, point number 9, a purely mechanistic understanding of vitamin D's roles in immune function must by definition be myopic and therefore of little value or perhaps even useless, because the majority of that type of research has to be based on in vitro and animal experimentation. So that's really never going to inform human clinical practice, even though it does tell us a little bit about mechanisms and biological plausibility. But beyond a few mechanistic notes, clinical evidence is what matters now, and that's what I'm going to focus on today. So here, let's look at functional knowledge and essential realizations, number 1. And again, as I've said before, you can pause the video anytime you want, so that would liberate me from having to read this word for word. A lot of these are notes that I think are important, but not necessarily notes that I want to spend time with right now in the interest of advancing this presentation and, again, focusing on the clinical research. So I'm happy to show you these notes, but I'm also happy to speed past them in the interest of saving some time today. However, before I leave this page, I will read the first 2 points. Number 1, vitamin D is active in essentially every aspect of nonspecific defense, innate immunity, and acquired defenses. Choose any aspect of general or immune defenses and then state that vitamin D plays a major role, and you'll be correct. And I'll give you a little more detail on that in one of the upcoming images. So let's look here at functional knowledge and essential realizations, part number 2. Again, you can read this entire page on your own time, but I do want to focus in on a question and an answer. How does vitamin D function to improve immune function and antimicrobial defense? The first answer that I would like for you to be familiar with is that vitamin D itself actually isn't doing the functioning. So as I state here, answer number 1, for the most part, vitamin D does not do the functioning as if it were a drug, but rather by enabling proper physiologic function and antimicrobial responses. My second answer is to say that to a very minor degree, vitamin D can function in a pharmacologic manner against some viruses, such as the so-called COVID-19 coronavirus. Furthermore, vitamin D can function in a pharmacologic manner when used in supraphysiologic dosing to achieve supraphysiologic levels of 25-hydroxyvitamin D and thus supraphysiologic activation of the VDR and other pathways. So again, the question is, how does vitamin D function to improve immune defense? The most important answer is to say that vitamin D actually doesn't function. It allows the body to function. So let's give credit where credit is due. Vitamin D, of course, is great, mostly in moving people from deficiency to sufficiency. But vitamin D itself almost never has a direct action. What's doing the killing and what's doing the defending and what's doing the work is the human body. Vitamin D supplementation simply takes people from deficiency to sufficiency so their bodies can function optimally, and that includes a more adequate and robust immune defense. However, we also have to allow, in answer number 2, that we do have some evidence showing that vitamin D appears to have a direct antiviral role against, for example, the COVID-19 novel coronavirus, and furthermore, that it also may function in some anti-cancer roles and immune modulatory roles, for example, against autoimmune disease, when supplied in supraphysiologic amounts, and I'll discuss that in the next video. Right now, I'm going to show you some evidence that 25-hydroxyvitamin D directly inactivates certain enzymes in the COVID-19 coronavirus machinery, and that this works in a manner analogous to some antiviral drugs. And again, like I said, supraphysiologic levels of 25-hydroxyvitamin D appear to provide supraphysiologic benefits against cancer and autoimmunity. I'll talk about that in the next video. Functional knowledge and essential realizations, point number 3 here. Let's talk about how clinicians make interventional and treatment decisions. So we can look at this from many different perspectives, but mostly what it comes down to is looking at what we call a risk to benefit analysis, and then including the ethical consideration, of course, that includes autonomy and informed consent. Again, for those of you who have studied medical ethics, you'll find this to be a little bit redundant, but certainly reinforcing of what you already know. But on certain pages of this presentation, I am going to talk about these kind of decision points, like how do we make decisions? Is using vitamin D a rational, evidence-based decision, or is it not? And that is, of course, the major point that I'm making throughout this presentation, is when or when not to use vitamin D in clinical practice against infectious disease. So the clarity that I want and the clarity that I want to gain and then share with you is based on objective, accepted criteria of clinical decision making. Can we apply those accepted criteria to the use of vitamin D against infectious disease? Of course, the answer is yes, but let's see how that plays out and if it ultimately gives us a green light or a red light in the clinical use of vitamin D in infectious disease in clinical practice. So again, I invite you to take a look at this page. Let's move on to page number 4 on this same theme, and you'll see that on that page I actually show you a summary, which I also show you in the image here on this page. So we want our interventions to be safe, of course. That's the ethical premise of do no harm. It needs to be beneficial. We call that beneficence. And we would like for our interventions to be beneficial against the primary or index disease, but also to have some collateral or secondary benefits. That would still justify our intervention. So for example, let's say we have an intervention against a specific disease and it turns out not to be effective against that index disease, but turns out to provide some collateral benefits that are still worthwhile. That would still be an intervention worth using. Drugs are used that way all the time in medicine, They may not provide benefit against the index disease or against certain parameters of that disease, but they provide benefits in other aspects of the disease or secondary components of the disease, or even tertiary benefits, we might say. So any of those benefits would justify the use as long as it's safe, as long as it's beneficial, as long as it's available and affordable, agreeable to the patient. At that point, we're justified. And we, as professionals who are trained to make these decisions, then we can advance with some level of confidence. Of course, we always want to monitor for adverse effects, but this is ultimately how we make clinical decisions. Safety, benefit at multiple levels, available and affordable, agreeable to the patient, they've consented to the process. At that point, we're justified, and at that point, we move forward. If we don't move forward at that point, then we're also potentially guilty of neglect because we have identified a safe, beneficial, available, and affordable treatment, and the patient has agreed. And then if we refuse to take action, then we are guilty of some type of neglect, which in this case is a specific type of clinical neglect or medical neglect, which I call nutritional neglect. So let's look at that again here. I'm just going to break it down. So this is page number 4 of Functional Knowledge and Essential Realizations. And coincidentally, I have 4 major points that are the 4 major pillars of medical ethics. And these are non-malfeasance, number 1, minimal or acceptable risk, and that's the principle of do no harm. So we're going to look at that and summarize that as being safe. Beneficence, benefit, it's worthwhile, it provides a primary benefit or a secondary or collateral benefit. So again, that's the ethical principle of beneficence. Number 3 here is justice, commonly called distributive justice, and this is fairness, sharing, equality, and affordability. So you'll see that vitamin D does indeed meet all of these criteria. In the doses that we're talking about today, it will always show to be safe. It's always affordable and available because a year's worth of vitamin D might cost $15 or $30, equivalent to about 15 or 30 euros. So in the healthcare world, that is supremely affordable. What we have to prove mostly is that it's providing either a primary or a secondary benefit. And like I said before, I think we should all be familiar with the ethical principle of autonomy, which can only occur with information and then the informed consent of the patient. So again, these are, without any doubt whatsoever, the 4 major pillars of what we call clinical ethics or medical ethics. Now, we could extend this list to include a few others. Sometimes the list goes to 7, but the 4 indisputable basic pillars of medical ethics are non-malfeasance, beneficence, justice, and autonomy, which includes informed consent. If we have all 4 of these, then our treatment is justified and we should move forward and implement that treatment. So now let's move from functional knowledge and essential realizations directly into biological plausibility, and I'll show you my antiviral model, which again I published for the first time in 2014, and of course I've used it in some of my other publications, especially Inflammation Mastery, 4th edition. So my model of viral pathophysiology is that we begin with acquisition of the virus. So the virus has to pass barriers. So again, like I said in video number 3, if we can strengthen those barriers, then that alone provides good defense against the acquisition of the virus. We can also try to attack the virus itself by using antiviral drugs or specific nutrients or botanical medicines that directly inhibit viral replication or viral viability. So certain botanical extracts, for example, and certain nutrients have been shown to irreversibly inactivate virus particles. And of course, those would be the ones that we implement as a defensive or kind of preemptive strike against viral infections. So again, step number 1 is acquisition of the virus. Once the virus is in, it has to replicate, and we can use various nutrients to inhibit that process. If the virus is successful in entering and then replicating, then the immune system begins to sense what's going on and mount a non-specific and also a specific T-cell mediated and also B-cell mediated defense. If the virus is successful in entering and then replicating, the next line of defense is the immune system, either innate immune system or the specific immune system, which itself has 2 components, that is cell-mediated defense and also humoral or antibody-mediated defense from the B cells that transform into plasma cells. And again, as I said before, the entire body functions together in the immune response, not simply what we classically think of as the prototypic immune cells. The entire body is working together here. So we have to support whole body health to get a whole body competent defensive response. So we all know that during the course of an infection, the virus enters, replicates, the immune system responds, but then we always see some type of cellular or systemic impact. So we have to address that aspect of the total phenomenon of the viral infection. So again, the virus enters, replicates, the immune system responds, but we always have a systemic or cellular complication, and we can also strengthen this cellular and systemic adaptation to the infection for clinical benefit as well, because we need to support mitochondrial function, we need to support antioxidant defenses, etc., because those systems are damaged during the course of a viral infection. So, how does vitamin D play into this model? Well, we know that vitamin D strengthens barriers, it strengthens the epithelial cells, and it also increases antimicrobial peptide production, in this case including secretory IgA, which is the immune globulin on mucosal surfaces, such as the gastrointestinal tract, genitourinary tract, oral cavity, and respiratory tract, including the lungs. Furthermore, we know that vitamin D strengthens tight junctions between the cells and also improves the microbiome, and that, of course, has effects throughout the entire body. In various models, 1,25-dihydroxyvitamin D inhibits viral replication, and we know that it also inhibits the transcription factor NF-kappa B, which participates in viral replication as well. As I showed you in video number 4, vitamin D also inhibits or modulates and lowers tumor necrosis factor alpha, which is an endogenous factor, it's a cytokine, that actually stimulates viral replication. So if we can modulate that or lower that or control that with vitamin D, then of course that would indirectly inhibit viral replication, and that would give the immune system kind of the upper hand or a strategic advantage. And what I'll show you right now is the new data showing that vitamin D functions as a mechanistic antiviral or a pharmacologic antiviral against the COVID-19 virus. Let's take a look at that right now from the American Journal of Physiology 2021. This was published in June. And let's focus on the title showing that vitamin D metabolites can inhibit the SARS-CoV-2 replication machinery enzymes. I'll read that to you one more time. Vitamin D metabolites can inhibit the SARS-CoV-2 replication machinery enzymes. Let's focus in on their research findings. Metabolites of vitamin D and pre-vitamin D produced in the skin following ultraviolet B exposure inhibited 2 key enzymes of the COVID-19 coronavirus. While 25-hydroxyvitamin D was impressively effective against both enzymes, other UVB produced pre-D3 metabolites were also potent. And, as I say here in my own words, one could reasonably anticipate a synergistic or entourage effect. Now let me show you 2 tables from this article. Here in their table 1, they show binding affinities of various agents against the SARS-CoV enzyme MPRO, as they've stated here. And again, this is specific to a replicative enzyme used by the SARS-CoV-2 virus called MPRO. Now let's look at the evidence against another enzyme here. So this is binding affinity of various drugs and metabolites against the COVID-19 enzyme RDRP, again in comparison with some standard antiviral drugs. And lo and behold, we notice that 25-hydroxyvitamin D, which is the dominant metabolite of vitamin D in the blood, we notice that that particular metabolite is actually the most potent inhibitor or binder of this enzyme, again, in SARS-CoV-2 or the COVID-19 virus, RDRP. 25-hydroxyvitamin D3 is something that we can increase in the serum very quickly through the use of nutritional supplementation. And again, it is the most potent metabolite against this particular enzyme of the COVID-19 virus, more effective than other vitamin D metabolites and more effective than all of the antiviral drugs tested in this model. So I invite you to take a look at that article if you have interest in it. Again, it was recently published, American Journal of Physiology, 2021 in June, again published by the American Physiological Society. So let's continue my diagram explanation here, again supporting the biological plausibility of vitamin D use against viral infections. So I've already discussed the acquisition step or the direct antiviral step. I talked about how vitamin D can directly and indirectly inhibit replication. Now let's talk about immunonutrition. So we know that vitamin D improves antigen presentation, cell-mediated immunity, immune globulin-mediated immunity as well. And occasionally, some studies have shown that vitamin D improves the response to vaccines, and that's what we would expect given what I've said above, and that is it improves antigen presentation as well as antibody-mediated immunity. And as I reviewed in great detail in video number 4, we know that vitamin D modulates or reduces inflammation. At the cellular and systemic level, we know that vitamin D supports mitochondrial function, reduces neuroinflammation, promotes inflammation resolution, also promotes glutathione formation and magnesium absorption, and that would provide some collateral benefits. And I also showed you in video number 4 a clinical study showing that vitamin D promotes recovery from virus infection and specifically the COVID-19 infection. And finally, with regard to cellular and systemic health, I also showed you in video number 1 how vitamin D alleviates chronic pain and pain amplification, and in video number 2, how vitamin D supplementation alleviates anxiety and depression. So I'm going to focus today on viral infections, but a lot of this information would be essentially the same for bacterial and fungal infections. So before we leave this page, I want everybody to focus in on what I had said before, and that is that vitamin D functions at virtually every level of non-specific defense, viral inhibition, and also immunity and systemic health. So again, in defense against an invading microbe, whether that's a fungus or a bacteria or a virus, the entire body has to work in unison. And that's why we're going to see our best clinical results from agents that improve health, defense, and resilience at every level, starting with the acquisition of the microbe. In the case of viruses, inhibiting viral replication, which occurs through human molecular machinery, and then again in response to all microbes, specific and non-specific defenses, and the cellular and systemic consequences and response. So again, the ideal agent, and in this case we're talking about vitamin D, would function at every level, blocking acquisition, blocking replication of viruses, supporting specific and non-specific immune defenses, and also supporting cellular and systemic health. Now again, this explains the biological plausibility of using vitamin D against infectious diseases. Let's add one more level of detail on the following page. Again, vitamin D functions at every level of barrier defense, inhibiting viral replication, also supporting innate and acquired immunity. Vitamin D also supports cellular and systemic health to reduce the burden, severity, frequency, and consequences of infectious diseases. And here I'll show you that vitamin D supplementation specifically increases production of interferon gamma. So interferon gamma is a cytokine, and the reason it's called interferon is because it interferes with viral replication. So again, if you're trying to explain this to yourself, to a patient, or to a professional colleague or a professional adversary, one of the things you could say, if they need something kind of focused, you could say, well, vitamin D improves gamma interferon production, and you know, of course, that the interferons block viral replication. So let's look at that here. From the Journal of the American Academy of Dermatology, April 2020, vitamin D administration increases production of interferon gamma measured in the serum here. So I'll show you this article more, but I wanted to kind of foreshadow it in this conversation again on biological plausibility and mechanisms. If someone needs a specific mechanism beyond what I've already discussed, we can tell them that vitamin D supplementation increases production of interferon gamma, and that interferon gamma has antiviral effects. So again, we've got kind of the biological plausibility here, and we have the clinical evidence here, and I have much more where this came from. So let's look at a few more details specific to vitamin D and interferon. I showed you this study previously in video number 4. We looked at this article from Cytokine 2015, showing that supplemental vitamin D increased levels of interferon gamma, and again, we know that interferon gamma is directly antiviral. So here's my definition of it. You can pause the video to take a read of that. But I want to show you a few highlights from a different article. This was published in Journal of Leukocyte Biology 2004. Again, the interferons are cytokines that famously interfere with viral replication. Interferon gamma also upregulates other aspects of the immune system for a more potent and efficient response to intracellular pathogens, and of course, all viruses are intracellular pathogens. Interferon gamma specifically supports the Th1 or cell-mediated type of immune response, and again, that's what we would expect against an intracellular pathogen. And in video number 3, I talked about antimicrobial peptides and other kind of nonspecific antimicrobial defenses. And we see that interferon gamma, which is supported by vitamin D supplementation, increases production of lysozyme defensins and cathelicidins. Those are the classic antimicrobial peptides. And since we're talking about interferon gamma, I also have to note the fact that the medical industry, which tells people that vitamins are a waste of money, simultaneously wants to advocate sales of interferon gamma. So the paradox is here that they're telling people that vitamins are a waste of money, and yet those same vitamins, specifically vitamin D, can be used to increase production endogenously of interferon gamma. So they don't want you to produce your own interferon gamma. They want you to buy interferon gamma, even though your body could make it itself if it had enough vitamin D, because the prescription interferon gamma costs $63,000. I'm sure that some of you remember my detailed presentation on glutathione and N-acetylcysteine, where I commented that I was impressed by the strength of the research, but then I was also impressed negatively by the fact that the medical profession hadn't followed up with the clinical utilization of NAC in clinical practice based on the strength of the research. And certainly, as you already know, I have the same kind of perspective and opinion on vitamin D. The research is very strong, but then what we see is an almost complete failure of the medical profession to take advantage of that research. And the consequence, of course, is that patients suffer with their burdens of disease while drug companies profit because, of course, they have the more aggressive marketing strategies, which these days includes political control. So this article, as you can see, specifically focuses on vitamin D in the treatment and prevention of tuberculosis. This was published in 2012, and you can see that the lead author here is Adrian Martineau, a name that you're going to see repeated in today's presentation. So in his article, he acknowledges that vitamin D is a known risk factor for the acquisition and progression of tuberculosis. He also notes that vitamin D appears to have clinical efficacy against tuberculosis. He says, we know that vitamin D was used to treat tuberculosis in the pre-antibiotic era. He acknowledges the safety and the low cost of vitamin D supplementation. And by extension, he acknowledges the massive public benefit that could be attained if we were to use vitamin D against infectious diseases. He states, quote, potentially huge public health consequences of positive results. But then you'll notice that, as I said before with NAC, you'll notice that the entire medical profession resists and almost refuses to make progress on this topic. And at the same time, they're always bemoaning the need for the development of new agents, which of course are usually drugs, and they state that this is a research priority. But you'll notice that the research priority very rarely applies to nutrients. So even when we have evidence of nutritional effectiveness against various infectious diseases, you'll notice that the medical profession as a whole, and in its entirety virtually, ignores that data in favor of experimental new drugs that have no track record of safety and effectiveness in clinical use. And again, you will definitely see that theme repeated when we look at the data specific to COVID-19. We know, and we have known for decades now, that vitamin D deficiency is prevalent throughout the entire world. And very importantly, what I'm showing you in this series of videos is that vitamin D deficiency is not a passive or inactive experience. Vitamin D deficiency is a pathologic state characterized by increased pain, depression and anxiety, impaired barriers, which then predispose to infection, inflammation, and allergy. Also the generation and exacerbation of inflammatory diseases, increased risk and severity and consequences of various infections, and ultimately, as I'll review in video number 6, autoimmune disease. So again, vitamin D deficiency is a pathologic state. It's not like the body is just sitting there in neutral as if it's on ice while it has vitamin D deficiency. Vitamin D deficiency is actively a pathologic state that needs to be treated. I also mentioned in the last video this book that impressed me, and part of what impressed me about this book is the importance of, as he said, asking the right questions, but also specifically, as he said, being right for the right reasons. And again, what I see is that the medical and political side of this infectious disease and nutrition conversation is still asking the wrong questions, ignoring the data, and using the wrong criteria for intervention. A lot of the research that I've looked at, and some of which we'll look at today in today's presentation, is still using the wrong dose of vitamin D, as I state here in point number 1, and also continuing to focus too much on the 125 dihydroxyvitamin D instead of the more biologically active form, which is 25 hydroxyvitamin D. So a lot of times you'll see 25 hydroxyvitamin D described as the circulating form or the marker for vitamin D status, and yes, that's true, but it's also biologically active. Some articles have stated specifically that 25 hydroxyvitamin D provides 80% of the biological activity at the vitamin D receptor. So ultimately what this comes down to is that by focusing on the wrong dosing and the wrong form and the wrong questions, we, medically and politically, are failing to take the appropriate action, which would be population-wide supplementation with vitamin D. And virtually all governments are complicit in this because they've been ignoring the data that's been published and that we've been sitting on now for the past 20 years. So we need to advance our understanding of vitamin D, but we also need to accept that understanding of vitamin D and then act on it instead of continuing to look at the data, publish the data, and then ignore that data when we need to be taking action on that data. So, regarding the use of vitamin D against infectious diseases, we've got the biological plausibility, we've got the clinical evidence, and we know all of the other technical criteria about availability, affordability, access, distribution, and its pharmacology. So by the time we get through today's presentation, you're going to see that we have plenty of biological plausibility and that really we are at the time, or actually past the time, where we need to be taking action. We clearly have the epidemiologic and case control association studies. We have a mechanistic understanding. We have access to the treatment. We know that the treatment is safe. And we know that with vitamin D, we are simply trying to replenish a deficient nutrient. We're not trying to do anything heroic or interventional or invasive here. We're simply advocating the radical idea that we need to give the human body the nutrients that it needs in order for that human body to function as it should, and therefore not suffer from various types of disease, in this case, infectious disease. Again, point number 5, in the case of vitamin D supplementation, all we're trying to do is simply replenish a deficient nutrient that should already be present within the human body at physiologic levels. And again, we have to confront the fact that the medical political machinery lacks the desire to find the truth on this topic. And when it does find the truth, it is either ignored, sidelined, or buried by the avalanche of bad research that was performed not to clarify the issue, but to actually confuse the issue. So look here from Archives of Internal Medicine, 2009, published by the American Medical Association. So what they showed here in this major publication, again, Archives of Internal Medicine, 2009, is that vitamin D appears to protect against respiratory tract infections. What they called for was randomized controlled trials to explore the effects of vitamin D supplementation against various respiratory tract infections or viral infections generally, and here we are 12 years later still trying to justify this action.